Good morning. I'd like to begin with an update on the latest case numbers for E. coli infections related to this outbreak. There are currently 351 lab-confirmed cases and a total of 37 confirmed secondary cases. As of this morning, 4 individuals remain in hospital. For these 4 children, I know that they are receiving outstanding care at Alberta Children's Hospital here in Calgary. And I would like to thank all the frontline healthcare workers who have been caring non-stop for these children. My thoughts are with those parents who continue to sit at their children's bedsides and with all families who have been impacted by this outbreak. The good news is that the number of new infections has plateaued, and most of the children connected to this outbreak have been cleared to return to daycare. I would like to take a moment now to update Albertans on the investigation into this outbreak. We first declared an outbreak on September the 4th, just over 3 weeks ago. It quickly became apparent that a central kitchen that provided food to 11 different sites was likely the source of the E. coli that has caused this outbreak. And we focused our investigation there. Now, just to give you a sense of the scale of the investigation that followed over the next few days, we thoroughly tested 44 different food items, 5 milk samples, and 5 oat beverage samples. We have interviewed hundreds of people that included daycare staff, children's families, kitchen staff, and food delivery drivers. In all, we were looking at a total of 1,063 children who attended the affected daycares, 211 daycare workers, 9 kitchen staff, and 3 delivery drivers. Investigators cross-checked their interviews with attendance records, combed through individual meal plans, some of which involve 4 separate meals per day, as well as some special menus, and also examined kitchen controls and timed food delivery routes. All of these data are analyzed and probabilities are assigned to all of the possible sources. What I can tell you today is that one meal in particular came out with extremely high odds of being the source of infection. Based on our investigation, we believe that meatloaf and vegan loaf meals that were served for lunch on August the 29th most likely contained the E. coli bacteria that led to these infections. Unfortunately, neither of these items could be tested, as they were either eaten or discarded before this outbreak was identified. While we now have a likely source, what we do not know exactly is what was contaminated or how. I do not want to speculate at this point on the answers to these 2 questions, as the investigation remains extremely active and is ongoing. It's also important to make sure that our work on this investigation is accurate and transparent. I've asked that we seek a third-party external review to validate our findings, to be sure that we have not missed anything, and to be sure that our analysis of the data is complete. When this work is finished, we will make this investigation report public. At the end of the day, this large outbreak is about people. It's about the sick children and their families who have endured so much. It's about the childcare staff. It's about the hundreds of healthcare professionals who who have been part of the response to this outbreak. I want to thank everyone who has cared for a sick child and to all of those who are currently working to understand how this outbreak happened. I want Albertans to know that we are doing everything in our power to answer as many questions as possible, and we will share our complete findings with everyone as soon as possible. I'd now like to hand things over to Premier Danielle Smith.
Good morning, everyone, and thank you, Dr. Joffe. Before I begin, I'd like to provide a quick update on the compassionate payments that we announced earlier for families with children enrolled in the original facilities that were closed due to the outbreak. I'm pleased to say that the portal opened on Monday, and parents have been informed by Children and Family Services that they can apply for their payments. As of yesterday, we've received approximately 775 applications. The last 4 weeks have been a terrifying time for hundreds of families in the Calgary area. These families have endured the agony of watching their children suffer from the battle against E. coli that should have been prevented. And we know as a government that we must take action to ensure that this never happens again. As previously announced, I've tasked the Minister of Health, Adriana LaGrange, and the Minister of Children and Family Services, Searle Turton, with reviewing food safety in kitchens that provide food in licensed childcare facilities in order to put in place the necessary measures to prevent this from ever happening again. And we're taking another step in this critical work. Today, I'm announcing the creation of an external review panel led by former Calgary Police Chief Rick Hansen to conduct a comprehensive review of government policy and food safety practices to keep our children safe. Throughout this difficult time, parents, the broader public, and members of our government have raised several difficult issues. And that's why Mr. Hansen will be joined by Alberta parents, childcare operators, food service operators, and food safety and public health experts. The panel will be examining all aspects of this tragic situation, large and small, as well as taking a full, broader look at the legislation and regulations that govern food safety in our province. I had the opportunity to meet with some of the parents at the hospital where they watched helplessly as their children battled the effects of the E. coli bacteria. During our conversation, some parents mentioned that they wish that the kitchen inspection reports were posted at the daycare where they could be seen, not just online. This is one example of potential policy changes that the panel needs to examine. I also requested that the panel review the inspection process, including the consequences for food operators when they have repeat violations, safety training requirements for all kitchen staff, and potential barriers to accessing those training requirements. In addition, I asked the panel to look at food handling requirements such as temperature control and storage both on-site, where the food is prepared and stored, as well as off-site transit to where it will be delivered and consumed. Let me be clear, these are just a few of the areas the panel will examine, and through their work, they may find other areas to focus on, and they can and will pursue those. I've asked the panel to work quickly, and while we wait for this important work to be complete, we will not hesitate to make changes if they're needed, when they're needed. Our goal is to develop a system that is stronger and safer, and one that every parent can trust. And I look forward to the panel's recommendations and the work we will accomplish together for the children and the families who've been affected by this outbreak, and for all Albertans. Thank you, and we'd be happy to take questions.
Thank you. We'll be going with one question and one follow-up today. We'll start off here in person in the room, if you'd like to line up at the mic at the front, and then we'll head over to the phones. We'll start with our first question at the mic here.
Hi, Terry from CTV. Thanks for taking my question. I guess first, if you can just give us an idea of how long this panel will take, if there's a deadline of when we can expect some results.
In speaking with Rick Hansen, he had asked for a little bit of time to assemble the panel. We wanted to put him in place first, and then he'll put the panel together, and what we'll be asking for is monthly updates. I had initially hoped that we'd be able to have the results back by the first quarter of the year, but his ask was that we just make sure that the investigation is thorough and complete. And so he didn't want to have sort of an arbitrary timeline to work towards. He asked if we could just give him a little bit of time to scope it out. And when he's got that committee together, we should have a better idea of how long that is actually going to take. But I'm hoping that it is. The reason we're assembling it this way is I think we need some answers quickly. He'll be giving us advice along the way. If there's things that we can act on immediately, we will. We don't need to wait for the final report if there's some things that are obvious. And then we'll see when the final report will be available.
Okay, and my follow-up is off topic for a colleague. Wondering, is it appropriate for Rebecca Schultz's husband to be a lobbyist currently trying to influence your government's land and water management?
I understand that he's registered under the lobbyist registry. The ethics commissioner has looked at his activities, given guidance, and there's been no violation.
Hi, Colette Dwars, Canadian Press. Just seeking some clarification on your program, your compensation program. The way it was worded, it sounds like it might include some of the later closed daycares, the partially closed daycares and the exclusion orders. Can you just clarify that for us, please?
I'll let the minister clarify that.
Great.
Yes, thank you very much. So as per the announcement last week is that any parent that was affected by a daycare closure as per the AHS rules pertaining to the event on September 4th, those parents are eligible to receive the $2,000 payment. So the program hasn't changed.
Still the 11 original then? Or?
Yes, absolutely. So the program hasn't expanded. It's important to note that just more daycares since the original announcement have actually become eligible for those payments.
So those parents are in the 19 daycares are all eligible for the program?
The exact details about who's eligible for it are actually on the portal, but yes, it's pertaining to those 19 daycares that were affected by the AHS closures.
Excellent. I'll let someone else ask.
Jonathan Bradley, Western Standard. The City of Calgary has charged the catering company with bylaw infraction, but the Calgary Police Service has not laid criminal charges. Is the Calgary Police Service investigating the catering company? Why or why not?
You'll have to ask the Calgary Police Service. That's I don't give direction to the Calgary Police Service. They'll have to make their own decisions as to whether or not something rises to the level of investigation. I did also see the charge that the City of Calgary issued is quite serious. It sounds like it could be up to $120,000 in fines. So obviously everybody is taking this very seriously, and we leave it to the different orders of government and the police service to decide if any other action needs to be taken.
So you mentioned that there are 775 applications for compassionate payments, and this seems like a large number compared to the amount of children who were sick and hospitalized. How do you determine who receives those payments and who gets what?
Well, as Minister Turton has said, there were the 11 original daycares that had the 1,083, but because of secondary infections, they had to make partial closures on several other daycares, I believe 8 other daycares. And so there's a process on the website to go through about which specific parents are going to be able to be eligible for that. I can turn it over to Minister Turton to give you more details about how they're determining who's eligible.
Yes, thank you very much, Premier. As I stated before, is that any of the daycares affected by the September 4th closure, the original 11, those parents are eligible for the compassionate payment. The program has not expanded, but since the original announcement, additional daycares have become eligible under the original criteria that we talked about that were affected by the HS orders to be shut down.
Can you talk about how you know which parents are getting them? We're getting the information from the daycare, aren't we?
Yes, so the portal is open. As the Premier mentioned, over 800 now, I believe, as of this morning, have actually put in applications into the portal. But any parent that has questions about if they're eligible or want to get additional information can go onto the portal. It's on the CFS website or also on my local social media, and they can get additional information about if they qualify.
Thank you.
Alana Smith, Globe and Mail. Question for my colleague in Ottawa. For the second time, Alberta has rejected a series of access requests for basic data from the Globe and Mail. This policy position could limit the province's access obligations in the future. Now, in June, you said that you were going to look into what happened. Just wondering what came of that inquiry.
Well, I talked to Minister Neudorf yesterday. I'm not entirely sure what report your colleague is looking for. I mean, we have a report that talks about $52 billion of additional cost if we were to meet the net zero requirements. She may have to be more specific about exactly what it is she's asking for. I'm meeting this afternoon with somebody who is doing modeling for us on the abatement curves. I mean, our intention is to make all of this public because it helps us in our conversation with the federal government on getting to a more realistic time frame. So I don't know if there's maybe something lost in translation there, but we're trying to be as anything that we can put out there that demonstrates that a 2050 target is realistic and reasonable. We're quite happy to share that. So I suppose we can follow up to find out what specific report she's looking for, but my understanding is that the information's available.
Sorry, I should be more clear. It's the report from Robin Doolittle and Tom Cardoso, and it's just about basic information under the Freedom of Information Act. We had asked for this before.
Sam?
Yeah.
Yep. And we'll see if we can follow up on that, okay?
Okay, thank you.
It was Robin Doolittle and Tom Cardoza.
Yeah.
Okay, thank you.
Hey, it's Aaron Collins with CBC National News. I just want to circle back to the panel there. So you've launched this panel to look into, food safety and this sort of thing around the province. The investigation is still ongoing, so there's obviously some questions about how safe the system is and how good the regulations are. So what should parents take away from this? Should they feel safe sending their kids to daycares and having their kids eat food? Is the system safe?
The system's safe. There was a problem with this one particular daycare, with this one particular common kitchen, and the investigation, as you heard, was very thorough. It sounds like there are still some questions as to what precisely happened in that kitchen that day that Dr. Joffe is going to continue investigating. But more generally speaking, I think there'll be some lessons that we can learn from creating a framework to ensure that safe food handling practices exist at all facilities that are providing food to parents. And as I mentioned, I think one of the things that came out was that just having the most recent inspection report allows for parents to have the information that they need to hold their own providers accountable. And that seemed to me to be a pretty good recommendation. So we want to just make sure that people understand the direction that we're going with this. But I think I take some comfort in the fact that this thorough investigation, all roads led back to this common kitchen. And that's why the investigation is going to continue to center on what actually happened in that facility.
Okay, a bit off topic here for my follow-up, but the federal immunization panel has recommended that folks get their COVID booster this fall. Just curious if we have a sense of when that's going to be available here in Alberta, and if the province is going to be launching any kind of campaign to encourage people to do that. And I guess personally, if you yourself are planning to get the shot.
I'll let Minister LaGrange tell you. I think we're just preparing the final details on the press release on that.
Before that, would you be getting the shot?
Look, I'm a healthy person. I tend to take care of my immune system, and I believe this is something I should talk about with my doctor, not media.
Sorry. Thank you for the question. And yes, we just received information from the federal government in terms of when we will be seeing those those vaccines available to the province. So we're working through the process. As always, Albertans do have access for flu, influenza, RSV, et cetera, all of the various vaccines that are available. So once we have that information, we'll get it out as soon as possible. As part of the normal course of business, typically vaccines are available the end of September, beginning of October, so we anticipate that information coming very shortly.
And just the same question to you, Minister LaGrange. Do you plan to get the shot?
It depends which shot you're talking about. Like I'm looking. I'm very healthy as well. I have a very healthy immune system, and you know what? I also believe that this is a personal decision for individuals to make. I will look at that as time progresses and what my journey is. But again, this is a personal decision. People have to make it for themselves, for their children, and we respect the decisions that people make.
Thanks.
Sarah Offen with Global News. Maybe this is the most appropriate for Dr. Joffe. I've heard from a lot of parents who are understandably very eager to have their kids go back to daycare. They're happy that their kids are now healthy, but they're waiting for test results, and they're frustrated that they haven't gotten those back. Are we seeing delays in that process right now? Is that perhaps linked to the transition back to precision laboratories? Can you comment at all on why it's taking days and in some cases weeks for these families to be able to get these negative test results?
Thanks for that question. There are a large number of samples that are being submitted to our laboratory. They are very quickly working through the samples. There is no real delay. There can be challenges getting the sample to the laboratory. But once it's in the laboratory, the testing is very quick and results are reported quickly. Now, some children require a single negative test, while some require 2 negative tests, depending on the exact circumstance. So if a child requires 2 negative tests, of course, that's going to require a longer period of time. But there is no delay in the laboratory.
Understood. Perhaps for Minister Turton, I just wanted to ask about one daycare in particular, which was Kids Space. We had understood that that parents were being told that they were not going to be receiving any kind of reduction to their fees for the time that was missed. As I understand it, and maybe it was Premier Smith that had said that, that compassionate payment, which the parents are being told that is to cover that time that is missed, that was not intended for that. Can you provide any clarification regarding that compassionate payment, and should daycares be providing compensation for that lost time from daycares?
Well, I think Premier Smith said in the last press conference that it was her hope that any of the daycares did the responsible thing and refund those dollars. And so I would hope that all daycares operators listening continue to listen to that advice. But regarding the compassionate payment, it is a one-time payment for any parent that was affected by the September 4th closures as per the HS decisions to close or partially close their daycares. So as I stated earlier, if any parent has any questions about if they qualify for the payment, look at the portal, contact our office, and we'll provide them all the advice that they need.
Good morning. Good morning, Logan Stein with City News 660. Just hoping to ask the Premier a question here. With the city announcing fines, as we've already discussed, up to $120,000 for fueling mines, I already start to see some people online saying that they don't think the fine is enough for what families have been going through. Just wanted to get, your thoughts on what you would say to these parents who still have kids in hospital, still very, very sick in some cases, and are trying to figure out how they got to this point.
Yeah, well, this is not the end, obviously, of the investigation, and it's not the end of what we'll be doing as a consequence. So this is just, I think, the first measure that you saw the city take based on their area of jurisdiction to recognize that they didn't have a business license to do the work that they were doing, and the consequences are severe. So I would hope that every facility is making sure that they're in full compliance with all of their permits. And in this case, we'll continue the investigation. It's nearing the end, it sounds like, with Dr. Joffe having one final piece to before that is made public, and then our investigation that we're doing with Rick Hansen may lead to more recommendations. So I think this is just the beginning.
And a follow-up to that question, do you have like a timeline in mind? Are we looking at, years in some cases before this is all finally wrapped up, or is it something that you think is?
Well, I can tell you, I had proposed to Rick Hansen that we have an interim report by the end of December and a final report by the end of January, and so that's my level of urgency on this, and he just felt like we needed to make sure that it was thorough and didn't want to rush it. He's got a number of people he's got to bring together, a number of interviews he'll have to do. So I want to just be respectful of the fact I don't think people want a rush report that's incomplete. I think they want a full and complete investigation. But my anticipation would be that this would be months, not years.
Thank you.
Thank you. And we're going to take 2 more questions from the floor here and then head over to the phones.
Hannah Said, City News. One Calgary mom whose 2 kids are still suffering from E. coli reached out to us, and she said she is feeling disappointed with AHS and the government. She says her kids are still at home, she's missing work, and the compassionate payment is not helping at all.
Well, she should be in touch with the minister's office. We needed to create some kind of bridge because we knew that there would be parents who would have these kinds of challenges. And so unfortunately, every person's circumstances are different. And we're hopeful that this will be enough to be able to assist those who are struggling as they continue to see their kids get well. We haven't done this before. It's sort of new territory for us. We'll take that under advisement. Hope this never happens again.
Thank you. I have a question for Dr. Joffe. The Calgary mom says that there is a lag in the test results. She says it has taken like 7 days for them after the test results after the samples were given to the hospital, and they're still waiting results, and the last results that they got were incorrect. She's frustrated.
So I can't speak to the specifics because I obviously don't have them for that situation. My thoughts are certainly with the mother and the children who have been sick. What I can tell you is that testing in the laboratory, there are two different kinds of tests that are done. There is a PCR test that looks for the toxin that causes this disease. That test is a fairly quick test with a 24 to 48-hour turnaround time. However, in some situations, children require culture to make sure that the E. coli that caused this infection is gone. And that culture can take up to a week to finalize and say that there is no E. coli present.
But what about the incorrect results that they are getting?
I can't speak to that. Our Alberta Precision Laboratories Public Health Laboratory is a very high-quality lab, and I obviously have no information about incorrect results, but if they would like to follow up with us, we can certainly look into that.
Thank you.
Rick Bell, Calgary Sun. Before I ask the question, I want to beg the Premier's indulgence. There's a guy behind me who normally would not get a question, and this is his first question he's ever going to ask. He's in state journalism. So I'm willing to surrender my supplementary question to him in order that he may get a question. I hope you don't mind.
Sam,
Feel free.
Is that okay with you?
I'll indulge you.
Okay, so he'll get my supplementary. I'm sure it'll be better than the question I have. I'm asking something different. I'll flash you my lapel pin and think this might be a hint of where I'm going. Last night, the government side in Ottawa met, late night meeting. The Prime Minister is presumably finally going to question period today on this whole chaos in Ottawa with regards to the Zelensky visit. The Quebec National Assembly weighed in yesterday and tried to distance themselves from what was going on in Ottawa, so there's a bit of a provincial precedent there. And why do you think, or do you think, and if so, why do you think this story is important? Not all the ins and outs about the speaker and who's the speaker going to be and all of that sort of stuff, but what happened and how the government of Canada has handled it so far. The government of Canada, not so much Speaker Rhoda because he's leaving, but how do you feel the government of Canada has handled this, and why is it important that something be done?
Well, I have Jewish staff members who were off on Yom Kippur, which is one of the most holy days in the Jewish calendar, and I can't tell you the hurt that has caused to members of the Jewish community that this occurred. It's humiliating for Canada. It's embarrassing, and I'm glad that the speaker's apologized and he's resigned for the mistake he made. It was extremely inappropriate. I think everyone recognizes that, and I'm watching it with interest to see if the Prime Minister will also apologize today.
Thank you.
Kevin Kratz, State Broadcast News. There's a lot of talk of the panels, charges, regulations, and compassion payments, but I just want to know if there's like a message that you're trying to get out to parents with their young kids in daycares. These panels and stuff only do so much. So, like, what is the overall message you're trying to put forward?
Well, I think part of it, the reason we had to get to the bottom of the investigation is so that people could have confidence in the daycare system, that they send their kids in the custody and care of providers every single day throughout the week for those who have got full-time care. And we wanted to make sure that parents understood that this was an isolated incident for an isolated kitchen, had a huge impact because of the common nature of it and a number of the practices that occurred there. But I think that we wanted to give confidence that we've isolated the kitchen in question, and we're going to work through any of the food handling practices that could potentially have led to this. The fact that it wasn't that the investigation wasn't able to pin down precisely which ingredient or which particular practice occurred means that we've got to look at all of the issues of food storage on site, preparation, proper holding temperatures, proper transport mechanisms when it's being delivered cold, when it's being delivered hot, reheating, what happens on site. So we have to make sure that all of those pieces in this particular facility are addressed, and then also be able to make broader recommendations in the event that there are similar practices that could lead to this sort of thing. I think that it's a good education for everyone about how important food safety is, how important food handling is, and just how much damage and harm can be caused if something goes wrong. I've been very pleased with the frontline response at the hospital. I think it's extraordinary that they were able to treat so many patients successfully, and we're still hopeful for those remaining 4 that they are out of hospital soon. I think AHS has done a tremendous job in being very detailed in their investigation. It's unfortunate that the 2 items in question just don't exist anymore for us to be able to state with clarity, with absolute certainty, but I'm glad that they were able to point to the balance of probabilities. I think that also gives some guidance about some of the potential harms when food is being handled. But I think generally speaking, if we've got anything that we can do in law, anything we can do in giving guidance on safe food handling practices, I think it's up to us to provide that guidance, and that's what we're looking at doing.
Thank you. And we should have time for 1, maybe 2 more questions. We'll go to the phones here. Operator, could you put through the first caller, please?
Thank you. Don Braid, Calgary Herald.
Hi, thanks for taking my call. I don't think anybody would question the incredible rigor that AHS has brought to the investigation, but also I'm sure everyone would agree you wish there had been no investigation in the first place. Could this have been prevented? It is very notable that there were 13 inspections over 2 years where many violations found, and to me it always seems very striking that the only mention of off-site shipping that wasn't either cooled or heated comes after the center was closed, indicating perhaps that the AHS inspectors weren't even aware of this. So I'd like to ask Premier Smith and Dr. Joffe if you could comment on that, and whether you think that AHS inspections should have been able to prevent this by perhaps earlier closure, a more rigorous attitude toward this particular issue.
Thanks very much for the question. First, let me emphasize that this investigation is ongoing. We are looking at multiple possibilities that might have led to how this outbreak has occurred, and so that is very active and ongoing. No final conclusions, of course, have been reached, and I don't want to speculate at this point on what we may find as we need to carry through with the investigation. To address your question or your point about food transport temperatures, there is a process that the investigators use when they inspect a facility. They do go through a checklist. There are approximately 25 items on the checklist, but beyond the checklist, what they are performing is a detailed risk assessment in the facility. And they're looking for physical, chemical, or biological hazards that may exist, and looking for ways to mitigate any risks that they do pick up on. Now, the reports that you see online reflect really just violations. If it is not reported online, then there was no violation detected. So again, there are 25 or so items that are gone through with each inspection, and they will not, what we do not currently have posted on the website is items that are found to be clear and that are being performed adequately. Now, it is common when an inspector visits a facility that the transport truck is not there. Of course, these inspections occur without warning. The inspector shows up, investigates or inspects the facility, and the transport truck may not be there. But there is a conversation about how food is transported, whether cold food is maintained cold below 4 degrees, whether hot food is maintained hot over 60 degrees centigrade, and it's up to the operator to report how they carry out their transport and how they maintain those temperatures.
And a follow-up, Don?
And that may just be...
Yes, sorry.
I'll just say, and that may be one of the things that comes out of our investigation is that it could be that if the truck is not on site, it could be that a separate visit is arranged to make sure that the truck is transporting food at the proper cold or hot temperature. It's possible that that may be one area that we have to have more rigor around based on what we've seen. There's just a lot of potential points of failure when you have a large kitchen entity with multiple vans delivering to multiple different sites and reheating potentially or refrigerating on site. So that's why we needed to have this separate investigation to see if there are any holes in the checklist or any additional processes we need to add.
As follow, I do understand that that this food was being shipped all this time without refrigeration or heating.
I don't think we know that, and ultimately it's up to the operator to maintain a safe operation and to perform all of their duties safely. The AHS inspectors, of course, visit and inspect what they can. Some of the information is provided by the operator, and ultimately it's up to the operator to operate a safe business.
Perfect. And thank you, Dawn. And that's going to be all the time that we have for questions today. Thank you, everybody, for joining us.